Welcome to OMFS Essentials, concise knowledge for the modern maxillofacial surgeon. In today's episode, we'll discuss the most common suturing techniques, their applications, advantages, and limitations. Mastering these techniques ensures accurate wound closure, optimal healing, and minimal scarring, essential in oral and maxillofacial surgery. Number 1. Simple interrupted suture. This is the most commonly used technique in all surgical fields. The suture is passed through both edges of the wound at equal depth and distance, and the knot is tied on one side. Advantages: simple, strong, and versatile. Each stitch is independent, so if one fails, the others remain secure. It provides good wound edge eversion when bites are slightly deeper than the distance from the edge. It's easy to remove individually if infection occurs. Disadvantages: it requires more time to place. Eversion control requires practice, and it doesn't relieve tension as well as mattress sutures. Number 2, continuous or over and over suture. This is a fast, efficient technique. After placing one simple stitch, the same strand is passed continuously along the incision, perpendicular to the wound line, and tied at the end. Advantages: rapid placement and even tension distribution. It produces a watertight seal, useful for bone grafts or areas needing fluid-tight closure. Disadvantages: if the suture breaks, the entire line may open, causing wound dehiscence. It should be avoided in high-tension areas. Number 3, continuous or locking suture. Similar to the previous method, but each pass locks by looping through the previous stitch. Advantages: faster than interrupted sutures. Locks prevent over-tightening and provide more secured tissue apposition. It reduces the risk of epithelial ingrowth along suture tracts. Disadvantages: tension cannot be adjusted once swelling occurs. If the suture breaks, the entire line may still open. Number 4, mattress sutures. Mattress sutures are designed to evert wound edges and relieve tension, ideal for areas prone to gaping or scar widening. They can be vertical or horizontal. Vertical mattress. The needle passes deep through both sides, then returns superficially to form a vertical loop. Advantages: excellent eversion and precise apposition. It relieves tension and aligns with flap blood supply. Disadvantages: time-consuming. May leave visible cross marks on the skin. Horizontal mattress. The needle enters and exits the same depth on each side, but runs horizontally across the incision. Advantages: it reinforces subcutaneous tissues and provides hemostasis at wound edges. Disadvantages: if tied too tightly, it may strangulate blood supply and cause edge necrosis or dehiscence. Number 5, continuous mattress. Placed quickly to close large lacerations in non-cosmetic areas. Advantage: rapid placement. Disadvantage: poor edge eversion, and if broken, the wound may open completely. Number 6, subcuticular suture. Used for cosmetic skin closure. Short, lateral bites are taken beneath the epidermis in a continuous fashion, and knots are buried at both ends. Advantages: excellent aesthetic result. Minimal marks or irritation. Disadvantages: does not evert wound edges well and takes longer to perform. It provides limited strength, used mainly when tension is minimal. Number 7, figure of 8 suture. A specialized interrupted suture, especially useful over tooth extraction sites. It stabilizes the soft tissue flap and adapts the gingival papilla around adjacent teeth, protecting the surgical site. Number 8, buried or inverted sutures. These are completely beneath the skin or mucosa with the knot buried inside. They are always absorbable and are not removed later. Applications: Ideal for tongue lacerations or intraoral repairs where exposed knots would irritate tissues or stimulate salivation. Number 9. Purse string suture. A continuous stitch is placed circumferentially around an opening, then drawn tight, like a drawstring bag, to invert the edges. Uses: in general surgery, it's applied around appendicular stumps or organ walls before placing drainage tubes. In OMFS, it can be used to adapt soft tissue around a reconstructed condylar prosthesis. Number 10. Through and through or retention sutures. Heavy sutures are passed through all layers of the abdominal wall, including peritoneum, to provide strong retention. Often used in abdominal surgeries to prevent dehiscence in high-tension wounds. Precaution: a finger should be placed beneath the suture during tying to avoid trapping viscera. Number 11. Buried coaptation and retention sutures. In this technique, deep interrupted sutures are alternated with retention sutures that pass through multiple layers. They are placed about 2 centimeters apart, providing strong closure and layered support in large wounds. Summary: each suturing technique has its own indication. Simple interrupted, versatile, strong, and safe for most areas. Continuous and locking, fast, but risk total failure if broken. Mattress sutures provide eversion and tension relief. Subcuticular for best cosmetic results. Figure of 8 and buried for intraoral and deep closures. Purse string and retention sutures for specialized closures requiring high strength. The art of suturing lies in selecting the right technique for the right tissue, balancing tension, eversion, and healing. In oral and maxillofacial surgery, mastery of these principles ensures predictable healing and long-term functional success. You've been listening to OMFS Essentials. Subscribe for more concise, evidence-based episodes. And as always, keep mastering the essentials.